Hey, welcome to this presentation focused on IBD clinical research hosted by the Crohn's and Colitis Foundation. We are pleased to offer education and other helpful information to those living with IBD. My name is Ria Bahadur, and I'm a patient and member of the Foundation's National Council of College Leaders. And participation in clinical research helps investigators learn more about IBD and improve the quality of care. I'm excited to be joined today by Keri Kemp, a researcher in the cardiorenal physiology and medicine section of the Department of Medicine at the University of Alabama at Birmingham. Keri is the primary author of a paper titled Racial and Ethnic Differences in Diagnosis Age and Blood Biomarkers in a Pediatric Inflammatory Bowel Disease Cohort. I'll be asking Keri questions about her research today.
Hi, thank you so much for inviting me. I'm really excited to talk to you about our new findings.
Yeah, we're so excited to have you. Before we get started, let's go over a few pieces of housekeeping. The information provided during this presentation is meant for educational purposes only. It should not replace any advice you receive from your gastroenterologist or primary care provider. If you have questions about your specific care, please reach out to your healthcare provider. The Crohn's and Colitis Foundation's IBD Help Center can offer support and information if you have any questions about Crohn's disease and ulcerative colitis by calling 888 My Gut Pain or emailing info@crohnscolitisfoundation.org. You can also access information about research on our website. So with that being said, let's get started. First, could you give us an overview of your research study and maybe some of its results?
Sure. So this paper looked at social determinants of health, which I think we should take time to define. So social determinants of health are things like race, ethnicity, income, education, language, literacy skills, even logistical barriers like transportation. And all of these things we know can affect people's ability to receive healthcare. And we know that social determinants of health have been shown to influence the diagnosis and management of inflammatory bowel disease in adults. But there's very limited information about how they may be affecting the diagnosis of IBD in children. So that was the main aim of our study. And so what we did was we enrolled pediatric patients seen at Children's of Alabama. This is located in Birmingham, Alabama. It's the major, it's the main referral center for Alabama and several surrounding states. And so, what we found was that racial and ethnic minority children are diagnosed on average at an age 2 years older than their non-Hispanic white counterparts. So this might reflect a delay in diagnosis. And we kind of wanted to know, well, what are some other factors that might modify this relationship between racial and ethnic minorities and this older age at diagnosis? And what we found was that parental or caregiver education seemed to modify this relationship. And so for those children who have a college educated parent, so a parent or caregiver that received a bachelor's degree, we found that there was no difference in age of diagnosis. In other words, parental or caregiver attainment of a college education might be protective against older age diagnosis. And we can talk about more reasons behind this later.
Yeah, before we dive into that, I was wondering if you could elaborate on the importance of getting a prompt diagnosis when you do have pediatric IBD.
Yeah, so with pediatric IBD, it could be more aggressive than adult IBD. So a delay in diagnosis for these children can lead to more complicated disease, more severe disease, and even greater rates in needing surgeries. It can also lead to stunted growth, delays in puberty, and can have adverse effects on overall health and mental health. And so having a prompt diagnosis is so important for these kids.
Yeah, and you talked about parents and like their level of education. I was curious if you had like some suggestions of how you would increase health literacy for parents, like especially those in these marginalized populations.
Yeah, so I think there's a couple of components to that. And there's a couple of different ways that people conducting health system research are starting to think about health literacy. So you can think about health literacy at the individual level. So how well can someone with IBD or a parent or caregiver of a child with IBD interact with the health system? How well can they understand health documents or directions from a physician, and how well can they advocate for themselves? And so that's individual health literacy. On the flip side of that, you can think about kind of the health institution literacy or the health system literacy. And this really puts the onus on the healthcare provider to communicate in a way to be understood. And so I think those are kind of the two avenues. So we could kind of work at community awareness of inflammatory bowel disease, but also at the provider level, think about interventions at the provider level that would allow the providers to better communicate, to be understood by their patients.
And are there any like nuances or adjustments that you'd have to make if you're considering like a rural like health system versus like a more urban health system?
Yeah, I mean, I think that's a really interesting question. And so in our study, we did include patients that live in both rural and urban settings. So again, they're traveling from their local community to Birmingham, Alabama to receive care. But we'd like to kind of delve into that issue in greater detail to assess things like how does transportation access affect your ability to receive health care? Or how does the availability of local healthcare providers in your community affect referral rates? And so we know here in Alabama, there are 23 counties that do not have a pediatrician. And so that may be having adverse effects on parents' ability to receive proper care and timely referrals to specialists. These are some of the questions we're gonna seek to answer going forward.
Yeah, and I know you defined like social determinants of health earlier, and you were talking about more considerations you'd want to make. Are there anything else that you think was like missing in your initial analysis that maybe in another study you want to do?
Yeah, that's a great question. So, in addition to looking at parental or caregiver education, we did have information about annual household income. We also had information about insurance type. So, were these families on private, public, or self-pay? And we also had information about whether these children live in a single parent household. And so with our small study of 114 pediatric patients and their caregivers, we found that these other factors did not modify that relationship between older age diagnosis and being or self-identifying as a minority race and ethnicity. We'd like to look at those in greater detail. So we were not able to specifically question parents and caregivers about their health literacy or language barrier skills. So that's something we want to look at in greater detail. And we also, because of our demographic makeup of our patient population here, which is majority non-Hispanic white and Black African American, we really weren't able to take a greater look into other races and ethnicities, such as Hispanic populations. To be able to do that, we would have to have a multi-center study and partner with other institutions, and that's something we'd like to do in the future.
Yeah, and then could you tell us maybe, I know there's a part of your research paper that's about blood biomarkers. I was just curious if you give us more information about the biomarkers that you considered in your study, and then also how they're important for the diagnosis of IBD.
Yeah, so when we saw this difference, this disparity in age diagnosis, we wanted to know, well, is there also a difference in disease severity among these children? And so to do that, we looked into these patients' electronic medical records. We were able to get their medical history, which included some common blood biomarkers that are usually looked at when patients are getting diagnosed with inflammatory bowel disease. And so these markers are often markers to measure inflammation in the body. So systemic inflammation throughout the whole body. And so we found that racial and ethnic minority children, when they were finally diagnosed, were 5.7 times more likely to have clinically elevated erythrocyte sedimentation rate. So what that blood biomarker is doing is it's looking at your red blood cells and how fast, when you take a sample, how fast do they settle to the bottom of the tube. So in people that have greater inflammation, these red blood cells will kind of stick together, clump together, or stack up on each other, and that will cause them to settle out faster. So if you have a higher erythrocyte sedimentation rate, that indicates that you might have greater inflammation in your body. Erythrocyte sedimentation rate has been linked to more severe disease activity in children with IBD. And so what that means is that once these racial and ethnic minority children finally did receive their diagnosis, they had a higher erythrocyte sedimentation rate, indicating they have greater inflammation, and they may have likely had a more disease severity at diagnosis.
Wow, it's really interesting. And then could you tell us about any limitations or challenges or barriers that you may have faced, like when conducting this study?
Yeah, we had several. And so this study began in December of 2018 and then ended in March of 2020 when the world shut down for COVID. So we had to stop our recruitment early. And so that limited us in our sample size. So again, this was, a study of 114 children and their parents and caregivers. And so the limited sample size, and then also that we, were the majority of our patients are either non-Hispanic, white, or African American Black. That's another limitation that we can't kind of generalize to, to other minority races and ethnicities. But we are looking forward to expanding this study in the future.
Awesome. And then I know you also in your paper talked about implicit bias and its role in healthcare as well. And I was just curious how you would go about maybe studying its effect on diagnosis or more of its consideration in your research.
Yeah, so implicit bias among healthcare providers means that healthcare providers may not realize that they have a bias towards um, towards their patients based on social determinants of health, so based on their race and ethnicity, or their language that they're speaking. And so to kind of get at that question, what we would need to do is have a study in which we are enrolling healthcare providers and then kind of collecting information about the healthcare provider patient interaction, and then also look at things like diagnosis and referral rates.
Yeah, I know you mentioned that earlier.
Yeah, so I mean, I think it's really interesting. There's at least one study of adults with inflammatory bowel disease that examined this, and they found that when Black African American adults are showing up in a general health practitioner setting, they were less likely to receive a full diagnostic workup when they were presenting with gastrointestinal problems. And so that also led to diagnostic delays in these patients. So I think it would be really interesting to be able to conduct a study to get at that with pediatric patients as well.
And then do you have any advice for how patients can advocate for themselves, whether it's pre-diagnosis, post-diagnosis, just about get like how they're feeling about getting the care that they need and anything along those lines?
Yeah, I mean, I think that for anyone that has a chronic disease themselves, or is a parent or caregiver of a child with a chronic disease, having a good social support system helps. And so I think for a single single parent or a patient who's single, linking out to others in their community, even linking out to other patients with IBD would probably be very helpful. And also, I know that there are, patient advocates that can help parents navigate the healthcare system. And so I think that having a strong support network might be very helpful.
And do you have any advice for patients who maybe are feeling a little hesitant about participating in research, or you could speak to like the value of patients being willing to participate in studies that are so important like yours?
Yeah, I mean, I think for this particular study, it was very helpful for the children and parents and caregivers to know that we're collecting information about how to improve the health quality of life for patients. So in this particular study, it only required about an hour or 2 hours of their time during their regular clinic visits. So being part of a study doesn't necessarily have to mean that it's a big time commitment. Oftentimes, you're able to be a part of the study during your regular clinic visits, and it doesn't add a lot of extra time for you as a patient. So I think that can be a barrier. People, I mean, to think of like, oh my goodness, this is going to take so much of my time to be a part of the study, and that's not always the case depending on the study design.
Yeah, and then I was also wondering if you had like a final takeaway from your work or any advice to any other patients that are out there that may, again, like be affected by implicit bias or social determinants of health.
Yeah, I mean, I think number one, just knowing that social determinants of health can affect the care that you receive, and that knowing that, I think, can empower people to and embolden them to be able to be better advocates for themselves or for their children with living with IBD. I am really excited that we have just received a large 5-year grant to follow up on this study. And so this grant is funded by the Centers of Disease Control, and it's the title of this grant is Improving Health Outcomes for Patients with Inflammatory Bowel Disease. So we've partnered with the Crohn's and Colitis Foundation for this 5-year grant, and we're going to look deeper into some of these social determinants of health. Our goal in this study is to enroll 700 adults and children living with IBD from the UAB, the University of Alabama at Birmingham, and Children's of Alabama healthcare systems. And so this new grant is really in 3 parts. And so the first part, we want to identify barriers and factors that impact health outcomes for IBD patients. We're going to specifically focus on those barriers faced by Black African American patients. And then in the second component of this grant, we're going to investigate to a further degree health literacy among these participants and how that might be affecting their diagnosis and management of their disease. And then the third part of this grant is really the part that the Crohn's and Colitis Foundation is leading. And the Crohn's and Colitis Foundation is going to partner with local community members and professionals, healthcare professionals, and they're going to work to develop and implement educational programs aimed at promoting earlier diagnosis and effective disease management among these people. So we're really excited about this new grant, and hopefully we'll find out even more information about how social determinants of health might be impacting people living with inflammatory bowel disease and what we can do about it.
Oh, congratulations. I look forward to following.
Yeah, it's
Yeah.
great. So if you live in Alabama and you are a patient at Children's of Alabama or in the UAB healthcare system, we would love to have you join our study.
Awesome. Thank you, Keri, so much for taking the time to discuss your research with us. I know I learned a lot. If you have any questions about IBD and participating in research, including clinical trials, please visit the Foundation's website at crohnscolitisfoundation.org and the clinical trials community. You can also contact the Foundation's IBD Help Center by calling 1-888-MY-GUT-PAIN or emailing info@crohnscolitisfoundation.org. As always, we recommend you discuss any clinical trial of interest with your healthcare provider. But thank you so much, Keri, again. Thank you all for tuning in. I know I learned a lot, and we hope this empowers you all.